Good evening. We'll wait for a few more people and then we will get started. Good evening to the few that have joined so far. Hope you've had a good Monday. Just wait for another couple of people to join and then we'll get going. A few of you have entered now. So let's get started. Today is all about headaches and migraines. Let me know if you can hear me okay as well. I am using different headphones, so if you can't, let me know before we get started. But today we're going to go through what are the differences between headaches and migraines. Often people don't know themselves that they're suffering from a migraine. They think it's just a really bad headache. What can cause them and what can be done to help. And one of the reasons that I'm doing this live is because notoriously people are actually really undiagnosed or misdiagnosed with migraines, and often it is really brushed under the carpet by GPs and other healthcare practitioners who just think, oh, it's just a headache, you'll be fine, take paracetamol, and that's really not the case. So the difference between a headache and a headache is often more localized, so it might be more in the head, in your face, it might be kind of around the back of the neck sometimes, whereas a migraine is often much more painful and is much more systemic as well. So typically we always used to say, oh, a migraine will present on one side of the face. Actually, we know from research now that that's not necessarily the case. So lots of people describe that they'd kind of just get it around that one area of their face, but actually you can get it on both sides at the same time. Sometimes you can just feel it into your face. But migraines can be very systemic, and systemic means that it affects lots of different systems in the body. So it can affect your vision, and that might be that you're sensitive to light, but it also just might be that you're having issues seeing, that your vision is blurred, you're getting tunnel vision as a result of the migraine. It can affect your hearing, so you can be very sensitive to noise or certain noises. It can also be triggering your migraine. It can make you feel sick, it can make you be sick, and you can get aura as well, which is where, sort of like I mentioned with the vision, you can have visual disturbances, but it can also be to do with different tingling, almost like a numbness feeling in your face. So, for example, I remember I had a migraine years ago, and my precursor to it was the whole day I felt like there was a hair on my nose. So I kept doing this all day, thinking I don't understand why I can still feel this hair on my nose. Then I had a migraine the next day, and I realised that actually that was a symptom of it. I just hadn't realised at the time. I'm fortunate. I don't particularly suffer with migraines. I get the odd few a year, and I tend to get them in my face personally. But my mum, who I think is on this call today, is a chronic migraine sufferer. So that's one of the reasons I thought I would do this chat today. It's something that I've learned quite a lot about just as a result of living with my mum, and she's done loads of research into it herself as well, but also typically in clinic, we are seeing more and more people that are coming with what they think are headaches or headaches as a result of neck pain. And actually, it is more likely to be migraines that they are suffering from. And we're actually the first people that end up diagnosing that for them rather than their GP. So I thought it would be an important topic to cover. Migraine affects an estimated more than 10% of people worldwide. Typically affects ages 20 to 50, but children do also suffer from migraines as well, so it's important to note that. And it's about 3 times more likely, or more common, in women than it is in men. About 17.1% of women suffer, about 5.6% of men suffer with migraines and sort of symptoms of migraines. Migraines is actually the third most common illness in the whole world. So, and yet we don't know loads about the brain. If you saw my Instagram story earlier, it's, compared to what we know about the knee, for example, we know a fraction about the brain in comparison to that. So it is something that we are still learning about, but as more and more stuff comes out, hopefully we can help more and more people. And actually, although we say it's the third most common illness in the world, it is likely it's actually larger than we realise because of the amount of people that are kind of misdiagnosed or not diagnosed at all, the amount of people that don't go and seek help for it, so just think, oh, I've just got a headache, I'm just going to pop a paracetamol. So that's important to note as well. Women face a much higher risk of having migraines than men do, and doctors don't really fully understand why this is the case. Sort of many feel like it's most likely linked to the menstrual cycle, and the changes in hormone levels. As females, we do get more changes than men get, so it's likely that is linked to migraines as well. And then 1 out of 4 women will suffer from a migraine at some point in their life, and headache is the third most common reason for women going to the emergency department, actually, in A&E departments. I thought that was interesting to realize. I didn't know that until I was actually researching to make sure I could give good information for this live. So it is, a massive issue. Looking at the common causes of headaches and migraines, one is vasodilators. So vasodilators, anything that is going to widen your blood vessels, basically. So an example of something that might widen your blood vessels would be if you exercise a lot. You often get you'll get vasodilation. So you might notice your face goes a little bit red. If anyone on here has ever seen me exercise, that's certainly the case. So that can cause migraines. Skipping meals can cause migraines. Weather changes, sleep deprivation, being stressed. I'm sure lots of you on this call have had it before, where you felt stressed, and as a result, you've got a headache, you've had to go to bed or anything like that. Excessive afferent stimuli. So afferent means things that are entering into the brain. So that would be things like flashing lights. If you're any kind of like strobe lighting that you've got, excessive noises, sometimes even smells, anything like that could cause a migraine. Head trauma, neck pain, and TMJ disorders as well, which is our jaw, which I have also done a live on before. So if you feel like actually you're getting jaw pain and you're getting headaches and migraines, there could well be a link there for you, and that's something important to explore, because you probably you may feel like they're two completely separate things, and actually the chances are they're not. They are linked in some way, and whether it's TMJ causing migraine, migraine causing TMJ, that's something that we can figure out for you. Or TMJ disorders can exacerbate a migraine that you've already got. Sort of going back to the hormonal factors, like we mentioned earlier, fluctuating estrogen levels in women, obviously throughout our monthly cycle, it does go up and down. So that can cause a migraine as well. So that's something to note. And certain foods can precipitate a migraine attack. So that can be certain types of cheeses, certain types of meat, mainly stuff that is more, what's the word? Mixed with lots of different stuff. I can't think of the word, but not sort of just plain chicken. It's more likely to be like your hot dogs, your bacon, and that kind of thing, not your single ingredient kind of meat food. Chocolate can also be a migraine trigger, and other food additives as well can often cause migraines too. Coffee and alcohol, especially red wine, is actually supposed to be particularly bad, but equally, some people find if they have a migraine and they have some coffee, it makes them feel better. So, these aren't hard and fast rules for everyone. And for some people as well, sugar can make a difference for them. Something that's also really interesting is genetics. So there is a positive family history of migraine in about 60% of cases, which suggests there is a hereditary factor. Not that we necessarily understand that hereditary factor yet, but we're aware that there is one. So frequently, if you've got someone that has got migraines, they may have a mother or father that also does too. So it is likely to stem down. And if you're unfortunate like I am to have 2 parents that have migraines, then the chances are you might be someone that suffers as well. But hopefully I've skipped that gene. And what I think is important to know is there's lots of, with all of these different triggers that I've just mentioned there, food, smells, sounds, lights. The list is almost endless. It's finding out what your trigger is. So if you're someone that gets migraines quite commonly, then the chances are your threshold for getting a migraine would be lower than someone that doesn't suffer. So for example, someone that doesn't usually get migraines might be able to go to that party with strobe lighting and loud music and drink loads of alcohol and barely get any sleep, because they've been out drinking and they missed dinner as well, and the next day they wake up completely fine. Whereas you only need to have the strobe lighting and the missing a meal. You don't even need to have the alcohol, the late night, or anything else, and you've got a migraine. So it's all kind of threshold based. And actually some of the medications that are available now are there to try and help build your threshold so that, yes, you still have the propensity to get migraines, but hopefully there's 5 different triggers that set you off instead of 2 or 3. With the other thing I think is important is if you are getting migraines on a kind of semi-regular basis, so if, say, you're suffering from them monthly, or every other month, something like that, it would be good to have a headache or a migraine diary that you do. These are really accessible. You can find them online on Google, and you just Google headache diary, it comes up, and on there you can then put in the day, the food you ate, anything you did that day in particular, and then like what your pain levels were like as well. So it might be that you can then see across the month, okay, I didn't have any headaches for the first 2 weeks, and then the last month actually, I did go out to some parties, I did this, I did that, or I just had to have a late night because I was working, or I was really stressed that week. But you can see it on your headache diary, and then you can see the following month that actually none of that happened because you had a really chilled month, or there's none of your triggers there. But at least it gives you a chance then to look back and see a pattern, hopefully across a few months, because if you can see a pattern, you can then make sure that you don't have those triggers or as many of those triggers, and prevent yourself from getting a migraine. With regards to the different medication that we have available, I'm just going to speak briefly about that before I kind of go on to how physio can help, but so we'll sort of talk about more of that in a minute. But with medication, you can take prophylactics, which means that you just take them every day, and it's meant to be preventative for headaches. This would be something like amitriptyline or topiramate. Amitriptyline is a really diverse drug, and we actually use it for a lot of different things. So we use it for as like an antidepressant in much higher doses. We use it to help people with sleep, and we use it for people with migraines. Typically, this is taken at night. It does send you off to sleep, and often you have a good sleep, but some people wake up feeling really groggy the next morning. That's a side effect that some people kind of don't enjoy, that sort of feeling of waking up and being like, my eyes are open, but I still feel like I'm asleep. And often the issue with these daily medications is that you get to a point where your body almost becomes immune to them. Like, it's used to having them all the time, and therefore before you were having quite a few migraines, and then they got better when you were first on these, and then it goes back to what it was before. So often you end up changing medication quite regularly. It's obviously not good for your kidneys and your liver to be on medication all the time, so it's not something that I'm necessarily recommending. But if it's something that you need to be able to get on with your everyday life, then there are options available like that. The other thing that's available as well is a triptan. So it's more of like a rescue medication. So you've got a migraine, you take it when you've got the migraine. The important thing with these pills is to notice that a lot of the time we hold off taking medication because we think, oh, it might go by itself. Like, oh, I won't take that ibuprofen, I won't take this, I won't take that. And I completely understand. You don't want to fill your body full of drugs. I get it. But actually, these triptans work best if you can get on top of the migraine before it's fully become a migraine. So a bit like my story that I mentioned a few minutes ago, where I felt like I had a hair on my nose for ages. That is a sign of a migraine that I didn't pick up on at the time. And I don't have any triptans or anything. I don't get migraines that regularly, like I said. But if I were to, that would have been the time to take it then, would be when I first felt that weird feeling on my nose, because that's a precursor to then having a migraine. So you want to be able to catch it as early as you can and take it then, rather than holding off thinking, I'll be fine, it might get better, because it's then not going to be as effective when you do take it. The other thing, which is new in the NHS, and generally you can only have this once you've exhausted all other avenues, is CGRP injections. So the idea behind this is that you have a monthly injection that you self-inject into your arms or your stomach, or your legs. And with that, it's meant to then give you kind of longer lasting pain relief. but it's called a CGRP injection because these are the kind of enzymes that cause pain in your brain, I suppose is the best way to put it. And the way that it works is if you go back to your science lessons, if any of you remember, you kind of have an enzyme, you have a receptor. So like a square enzyme, square receptor would meet like that, and it tries to block that bond, basically, is how the CGRP injection works. But the other way that it works as well is what I was talking about earlier about increasing your threshold. So it aims to try and increase the threshold whilst you're on it of what causes a migraine, so that then after a period of time, your threshold before you get a migraine is so much higher that, yeah, you still might get them, but you need to be set off by multiple things rather than just one or two things. So that's just a very brief overview of things that are available. There are also Botox injections, there are occipital nerve injections that go in through your eye here. But yeah, I think with all of them, some people have success, some people don't, so it's an option that you can try. With regards to how physiotherapy can help, our randomized controlled trials, which are the ones that we see as kind of the better research that's been done, rather than kind of like case studies. Randomized controlled trials look at a lot of people, and that shows that actually massage therapy, physiotherapy, relaxation, and chiropractic or osteopathic spinal manipulation techniques is actually equally as effective as propranolol or topiramate in the prophylactic management of migraines. So that is helping to prevent migraines. Actually, like physiotherapy can help with that, which is really interesting. I think that basically is going to work in a few different ways. As physiotherapists, if I'm seeing someone that's got migraines, firstly, I'm going to ask them a few questions about, let's see what their triggers are, but also just looking at them physically. What does their body look like? Are they, is their posture bad? Are they slouching? Is their chin coming forward? Is there obvious areas of weakness or tightness around their head, middle of their back, their neck, that kind of thing? Because if there is, this could well be one of their triggers, is that all of their neck musculature gets sore and tight, or their TMJ, like we spoke about before, and that brings on a migraine. Therefore, as a physio, I can't prescribe you drugs. I can advise you if I feel like that's necessary to go to your GP and look down that route, but I can deal with all of those things. So I can advise you on stretching, I can use soft tissue to help you, I can use acupuncture, I can do mobilizations, manipulations, all of those things that can then leave your body in a more relaxed state, which then help prevent your migraine. So it might be that instead of getting 4 a month, for example, you're then getting maybe 1 or 2. So I'm not saying that physio is going to 100% treat your headaches and your migraines and it's going to mean you're never going to have anything again. Like I said, there's normally lots of different triggers for a migraine, but if one of your triggers is having areas of tightness or weakness, that's something that we can definitely work on to get you improvements in your migraines. And it might mean then that you're suffering less frequently with them, which is obviously great if that's something that you have been struggling with. And physio kind of focuses on all of those areas of dysfunction so that we can strengthen up as well any areas that we think are weak. And also, as a physio, I'm looking at you what we kind of call holistically. So I'm looking at you as a whole person. I'm monitoring. I'll ask you questions about your sleep. I might ask you questions about your stress. I know what job you do. And if you're sitting at a desk all day and I know that you're kind of like this, I'm probably going to advise that you move a little bit more, and that might help your migraine too. And taking a break from screens might help your migraine, that constant light that's filtering in. So as physios, we try and look at it as a whole picture of, okay, what triggers can we maybe advise you on, or what triggers can we work on with you? And then physically, how can we help improve you so you get to the point that you're no longer suffering as frequently as before, is what we're kind of aiming for. And to get that threshold for getting a migraine up a little bit higher. So I do have a few patients that do suffer with migraines, and they do find that therapy can be really useful. Some of them use it as kind of a prophylactic to help prevent them from getting migraines. So we do work through their neck and shoulders and that kind of thing. And I have had a few that have messaged me when they've got a migraine, said, can I come and see you? Can I have some treatment and see if that helps as well? And often that does help reduce the pain of a migraine too. So I think they're the sort of main ways in which we can help. Like I said at the start, headaches and migraines, there are distinctions between them, and migraines are that bit more debilitating for people that suffer, unfortunately. And there's lots of different triggers. So as physiotherapists, we're just trying to work on the ones that we can manage and hopefully reduce those so that we can then, over time, you can end up with less frequent episodes and less pain as well. If you have any questions, now is the time to ask them. I'll give you a minute or two just to pop them in the chat. But as with anything, if you come out of this and then think, oh, actually, I forgot to ask this, just drop me a message or write it on the group chat. Might be that someone else is thinking it too. I'll give you a second to write any questions. If, of course, you're suffering with migraines and you want to see if we are able to help you with any of those kind of trigger factors that you've got there, then just drop me a message and I will let you know. We can get you booked in. I don't think anyone's got any questions. If anyone does, let me know. But thank you so much for joining tonight. I hope you have a lovely evening. Bye.